The purpose of this voiceover PowerPoint is to provide you with a concrete example of the use of percentiles in a nursing research study. Please print out the article, Patient Knowledge of Atrial Fibrillation, under Module 3 before continuing with this part of the lecture. I will now give you a short synopsis of the article about patient knowledge of atrial fib. The purpose of this study was to assess patient knowledge about AFib, its determinants, and evolution during 3 months after a visit to the ER. A questionnaire was administered to patients at the time of their ER visit and again 3 months later. The questionnaire was developed to assess the knowledge level of patients with AFib and is divided into 5 sets of questions covering 1. AFib as a disease, 2. Detection of AFib and seeking treatment, 3. Anticoagulant therapy, 4. Impact of AFib on everyday life. So please pause this now and take a good look at the questionnaire in the article. There were 31 statements to which a patient could choose from yes, no, or do not know. There was an attached demographic sheet and the question to assess the level of empowerment of the patient by asking how well the patient was coping with AFib, to which they might answer excellent, good, fair, or poor. The patients were also asked to rank their current health status. A total of 200 patients completed and returned the questionnaire. Frequencies and percentages were calculated for background characteristics of the patients. Medians and quartiles were calculated for the sum scores on the questionnaire. Finally, logistic regression was done to predict which factors were associated with poor knowledge. Now, we're only going to look at Table 3, which is an example of percentiles, which is on this slide. The researchers first coded correct answers with a 1 and incorrect or do not know answers with a 0. Then each patient got a sum score for each section of the test. For example, on the section of the test about AFib and its treatment, a patient could score a 0 if he or she answered none of the questions correctly, or a 7 if all were answered correctly. All of the sum scores for each patient were then laid out from lowest to highest, and the median was calculated, and the scores at the 25th and 75th percentiles were calculated. So if you look at the table for AFib and its treatment, answering 3 questions correctly was considered to be poor. Answering 5 questions correctly was considered to be the median, and answering 6 questions correctly was considered to be good knowledge. The same procedure was done for AFib symptoms with a possible range of 0 to 6, detection of AFib and seeking treatment with a possible range of 0 to 6, anticoagulation treatment with a range of 0 to 7, and the effects of AFib on everyday life with a range of 0 to 5. These same calculations were done again at 3 months after the visit to the ER, and the scores were compared to see if there was a significant change. You can see that there were 2 areas that showed improvement from the ER test to the 3-month test. One was in the detection of AFib and seeking treatment. The scores went from 3 to 4 to 5 at the ER visit, to 4 to 5 and 5 at the 3-month visit. And this was significant at 0.026, and we're going to be discussing p-values in another module. The other was in anticoagulation treatment. The scores went from 3, 4, 5 at the ER visit to 5, 6, and 7 at the 3-month visit. The researchers found that this change was also significant with a p-value of 0.000. Just as an FYI, I wondered why they would assume there would be a change in patient knowledge, since patient education and treatment followed only local protocols, meaning that the researchers did not provide the educational intervention. This means that some patients may have had good education and others may not have gotten any at all, and that certainly would impact the findings. So I hope this little voiceover helps you understand percentiles.